So I'm outside of my patient's room, and I'm looking at my doctor's order. Looks like we have an order for an IV. Let's say so, name, date of birth, she has allergies, and all of that. All right, so I'm going to go up to the patient's room with my supplies. Knock, knock. Hi, I'm Debra. I'm going to be your nurse today.
Hi, Debra.
Hi, can you please tell me your name and date, please?
Phyllis Smith, 5/12/75.
All right, thanks, Phyllis. So, Phyllis, looks like we have a doctor's order to go ahead and insert an IV.
Oh, okay.
Have you had one before?
Yes.
You have? Okay, good deal. Do you have any complications with it or anything?
No.
Okay. All right. So, I'm going to go ahead and put a tourniquet on you and palpate a vein, okay? And then we'll see what we find here.
Yeah. Because I know we're running very late on the time probation.
There we go. All right, I'm gonna have you make a fist for me if you would maybe pump that a little bit. Oh, you have a good one right here. Okay. I'm gonna go ahead and clean that with an alcohol swab. Pop that tourniquet. Do this for 30 seconds. How are you feeling today?
Pretty good, thank you.
Good. I understand you're a little dehydrated, so we're going to get that taken care of.
This should help me feel better, right?
It will.
Because like the document.
Just do
But then it's like
Okay, so while that is drying, I'm going to go ahead and prep my supplies, okay?
Okay.
oh no, right.
So, hand hygiene. Your gloves.
Doing it so
Boy, I had a habit of not letting that hand sanitizer dry enough, and then it takes a bit to get those darn gloves on. Okay. So, got my supplies right here. First, I'm just going to go ahead and kind of go back and break my seal on this. Alright. Put that back. And I've got my connector tubing. This here, so I'm going to go ahead.
yeah, I got Sarah too. Yep.
And I want to go ahead and prime the line. Oop. Okay, and then I'm going to clamp it.
Sarah, not
Alright, so I've got that ready. Open my needle. Make sure that's ready. And I've got my Tegaderm. Okay. Alright. I'm going to go ahead and take my gloves off again.
You're so
Yeah, do another hand hygiene.
I think you wrote pump too, and I didn't say it.
Might be one too many hand hygienes. That's okay. Better safe than sorry. Alright. Alright, so I'm back with my supplies. Guess I never left your room, but you know, we're all ready. So we're going to just tie this little tourniquet up again. Alright. I'm not going to touch your arm. I'm going to... Alright, so we're going to get going on this. I'm going to anchor your vein. Got the needle bevel up. You're going to feel a poke. Oh, I'm so sorry. A little flash. Alright, so we're going to leave that there. My taper.
Yeah, thank you.
Come on. There we go. Alright, so get this to basically anchor down the IV. I want to make sure it didn't touch the skin under there. Alright, so Oh, I forgot to take the tourniquet off. Should have done that as soon as I saw flashback. That's okay though. And we're gonna go ahead and pull the needle and anchor the vein. Ooh. There we go. All right. So I'm gonna open my clamp, pull back. See a little bit of pink in there from the blood. Make sure the vein is patent. About 3 to 5 cc's. Okay, so now I'm gonna go ahead and clamp it back. Closed. I'm gonna take my Tegaderm stuff off, and I want to anchor down my little guy here. Okay, so we're gonna do that. We don't want to cover the E, and I'm gonna put my initials, date, and time this was done. And remove that little guy, which I probably could have done a second earlier. All right, how you feeling?
Doing good, thank you.
Good. All right, so I'm gonna go ahead and dispose of the supplies. I'll be back in about 15 minutes to check on you, okay? All right, thank you.